Okay, so now we're going to talk about leveling your pelvis when you're upright, standing, walking especially. So we did some of these before in some of the other videos. Just standing, same thing we did, pistons kind of through the front of the pelvis here, tilting like this as you stay tall through your chest and head, and then the shifting, lifting, making sure your weight's as equal as it can be from side to side here. So three-dimensionally kind of leveling that pelvis. Now, that's your neutral. That's what you want to try to get to. As you take a step forward, peeling that pelvis back like you're sitting in a chair, what you're going to see here is that when you take a step forward, naturally that front foot, that pelvis is going to be forward relative to the back one. But what you're going to do when you peel that back is you're actually going to try to level that pelvis from the piston perspective. Then you got to tilt it here to level your bucket, keeping that chest up and forward. You're going to really feel your abdominals engage here if you're tight, and your hip flexors and your low back. You want to try to avoid pain, but you might feel stretching or tightness in those areas that are common. So then as your weight's coming forward over here, we're pulling that back, leveling that pelvis, otherwise making sure your weight's kind of adjusted. Generally, you want more weight over that front leg, so it's okay if you feel like that's a little bit grounded there, but still trying to level from that front and back leg through that pelvis. Then that's the bottom of your elevator. Your front leg is your elevator here. We're going to lift up by lifting that back heel and driving through that front leg to straighten out. Again, at the top here, second crucial point. You want to level your pelvis here in a very similar way as you tension through that back heel, drawing in from that core and stretching tall. So again, you're going to small step forward, sink down like you're sitting in a chair, level that pelvis three-dimensionally, lock it in from the core as your chest is forward over that front foot, lift up, lift the back heel, lock it in at the top, and that's pretty much it. The last piece there then would be shift, lift, and you would be driving like with the boxer through here as with a level, stable pelvis and control on to your next step. That's it.